Hello, this is Dr. Jamali from OMS of NY. We have been getting a lot of questions for tooth extraction. I am here today to answer some of the most common questions. A dentist will recommend a tooth extraction when the tooth is not salvageable, when they feel that the tooth cannot be saved, whether it has periodontal disease or cavity or it has a fracture, then they recommend removal of the tooth. Routine dental extractions may or may not require oral surgeon. This depends on the skills and knowledge and comfort level of your general dentist. All tooth extractions are considered oral surgery. Some of them are basic and some are more complex. A dentist will give you anesthesia during tooth extraction. A general dentist usually gives you Novocaine or local anesthesia. In our office, which is an oral surgery office, we provide local anesthesia and IV sedation if necessary. Removal of premolars for orthodontic treatment does not have side effects. The only thing you have to worry about is change in profile, which you have to discuss with your orthodontist. Periodontal disease can be halted by tooth extraction. Periodontal disease is a disease of the tissue around the teeth, and when you remove the teeth, the periodontal disease disappears. You should care for your mouth after tooth extraction procedure by following the instructions carefully. Basically, we recommend staying on the liquid diet for first day or two, taking cold food like ice cream, yogurt, first day. And for the next 2 weeks, you would stay on softer food. No exercise, no using straws to drink, and no alcohol for 10 days. Some of the pros and cons of the placing an implant after tooth extractions are, you will have your bite and occlusion back if it's a front area of the mouth especially, and you will be able to chew and function for a long time. You do not have to remove any fake teeth. Dental implants are stabilized in the bone. Some of the cons are basically cost, which basically it comes to the same cost as a dental bridge. But every procedure has its risks, which you should discuss these with your oral surgeon. When the blood clot comes out after tooth extraction, this may cause severe pain. So you should stay on a softer food and do not exercise or drink alcohol, smoke cigarettes for 10 days to avoid removal of the blood clot. Some of the do's and don'ts of aftercare for tooth extractions are stay on a softer food, follow the instructions carefully, take your antibiotics and pain medications, and do not use straws to drink, do not exercise, do not drink alcohol, and do not smoke for 10 days. You cannot exercise after tooth extraction because exercise will increase your heart rate. You may feel throbbing pain, especially at night, and you may also lose the blood clot that's in there. And if you lose the blood clot, you may get dry socket, which is severe pain. What works best to preserve the jawbone after tooth extraction is, in our office, we place an implant immediately, or at least put some bone graft in the socket to maintain the volume of the area so you can have implant later on. You should schedule the tooth extraction procedure hopefully before you get infected or you're in pain, and when your general dentist recommends you to see an oral surgeon. This is Dr. Jamali. I hope I have answered some of the questions you may have for tooth extraction. If you have any more questions, please visit our website or call our office.